Hello and welcome. My name is Alana Gordon. I am a reporter and producer at The World covering global health. This is a Facebook Live Q&A about the coronavirus pandemic, leading emergency preparedness and response. So with me is Leonard Marcus. Hello. Thanks for joining.
Nice to join you.
And Leonard is co-director of the National Preparedness Leadership Institute, a joint program of the Harvard T.H. Chan School of Public Health and the Harvard Kennedy School. You can post your questions for Lenny and myself on Facebook at Forum HSPH and at PRI The World, or you can email them to theforum@hsph.harvard.edu. So this Q&A is jointly presented by the Forum at the Harvard T.H. Chan School of Public Health and The World from PRX and WGBH. So I want to begin. Crisis management is such a huge topic right now, and you have guided leaders in their responses over the years to terrorism, natural disasters, other human-made disasters. So what makes this COVID-19 situation unique, and how are we doing right now?
Well, thank you, Alana. That's a good question. There are many things that are making this COVID-19 crisis unique. First off, usually when we're studying a crisis, the crisis will be in a particular area. There'll be a hurricane, or there'll be a terrorist event in a certain area, or a tornado in a certain area. In this particular case, this truly is a global event. The other thing is that this is affecting everyone personally. There's no way to run away from this. So it's a personal crisis for everyone as well. And it's a crisis that's outside of the experience of most people in this country. This crisis in many ways made it around the world through our transportation systems. So we can look back at the 1918 pandemic, and there are many similarities. And yet, for all the reasons that have to do with 2020 and COVID-19, this is a very unique situation that we're in right now.
So the similarities?
The similarities is we're mounting the efforts on emergency responses. So all of our agencies are busy at work. Though when I speak to their leaders, they'll say, we're doing things now that we had never imagined we would be doing before. It's on a much larger scale. Like other crises, there's a political nature to this. So there's the politics of the president and governors and mayors, and that always is a factor in a crisis. And then finally, we're asking the population to comply with the requests and sometimes the orders from public officials. And we find a whole variety of experience in that compliance. For example, in a hurricane, people along the coast are asked to evacuate, and some do, many don't. So we're seeing many of those same qualities. It's just on a much bigger scale and much bigger scope than we've ever seen in recent memory.
And so when you think about the present day crisis and what's unique about it, where are we at right now? How would you describe that and place us for having this conversation?
So one of the things that we find in studying leaders is that leadership and a crisis like this happens over an arc of time. So you have that early phase where you're just beginning to get a sense of what's happening, and that activity is beginning to grow. So this particular crisis happened in December, maybe even earlier in China. Well, by the time we came to late January here in this country, I was able to visit with the CDC. This is late January. There were 5 cases in the United States. So the United States was just beginning to go up that arc of time. And of course, in a very, very short time, we're much, much further along. There are many, many cases there. We're very, very involved in this. And we know this is going to rise. We're not yet at the peak. On the other side of that peak, we're going to go through a very, very different phase where we're starting to look at how we're going to recover from this, how we're going to open up some of the limitations on staying at home. So we view a crisis like this over an arc of time. You need to understand where you are in the moment, and you need to prepare for what's going to come next.
So what you're saying is we're kind of, again, can you just reiterate that and place us again where we are right now in the arc?
Yeah, unfortunately, we're not yet at the peak. So we're seeing, for example, here in Boston, that the numbers of cases are on a consistent elevation. We're seeing that in places such as New York. We're beginning to see that in other places around the country, Detroit, Louisiana. The other puzzle here is that we're certainly seeing this in large urban areas. We're beginning to see large numbers of cases in rural areas, which has very different healthcare system, very different set of constraints in their response. So we're still very much climbing this arc of time.
When you think about the preparedness and where we are, I mean, the U.S. can be seen as pretty decentralized, and when you're at these different places, and I wonder how that fits into the preparedness and response. How do leaders at different levels work together?
So that's been another one of the perplexing things about this response. Ideally, you'd like to have a uniform approach to a crisis, especially for a pandemic. You'd like to think that every state was doing it the same way, that our country was doing it the same way. And so what's perplexing about this is because there hasn't been a centralized, consistent message coming from the federal government. Different states are handling this in very different ways. Different localities are handling this in different ways. And the concern for us is that the public could be confused. We are dependent in the public on an individual's behavior. I just heard a story the other day where someone wasn't feeling well, went to get the test, and before getting the results, he went to work. And he was, in an essential service, working with other people, exposing other people. Of course, we hope nobody does that, but we're right now dependent on the responsible behavior of individuals. And again, that's something that's very unique about this crisis.
What role is there of the private sector?
So the private sector is absolutely critical. Government can do so much, but there are people standing up. We've heard of the Patriots sending a plane to China and bringing back materials. There are companies in the private sector who have ramped up their production in order to provide for the personal protective gear and ventilators. So the private sector is critical, and certainly right now we're dependent upon the essential services for the food service, the supply chain there, for deliveries. So the private sector in many ways is having to fill some of the gaps in order to maintain life as well and as comfortable as possible for the population, making it possible for all of us to stay at home and shelter at home.
It's tricky. And one of the things I wondered about that you mentioned is when you have being kind of approaching a sort of peak in a crisis, you talked about how leadership is important to also be planning out many steps ahead. So what is that planning, or what should that planning look like right now? Because on the one hand, we want to know, what do we do after, how do we get back to work? How do we get back to living our lives? And on the other hand, like, how do you do that in a way that's planned to set it up to happen when it needs to or when it can? So how do you think about that?
So sadly, right now, what leaders are having to focus on in many cities, we see this in New York, is there are more deaths than our current system is able to handle. So there are questions about how to document those deaths. People are dying at home. What to do with the bodies, what to do about funerals. So we're right now at this very, very sad and tragic phase of this arc. On the other side of this, when the curve starts coming down, we have to talk about recovery. So, for example, the questions are, what about people who've had the disease, not necessarily people who tested positive, but people who had the disease and they're immune? And what role could they play? For example, in healthcare, if somebody's immune, they might not need, if they've got some immunity to the disease, they might not need the same level of personal protective equipment as other people. Then people in the restaurant business are beginning to think about, well, what is it going to mean to open up our business? How will we do social distancing in the restaurant business? It's possible. The people at the airlines are talking about how to maintain social distance once that service begins. Right now, of course, if you do fly on a plane, there are very few people on the plane, so it's easy to do physical distancing. So different industries are beginning to think about what are the steps that we can begin to look at and begin to plan for, so that when those numbers go down, and we can look at what's happened in other countries in China and in South Korea. We can look at what's going on in Seattle and California to take lessons from them. What's really interesting about this crisis, everything that we're experienced has already been experienced before. So we look at what's going on in this country right now. Italy experienced it. So it's a matter of learning what they're doing, learning those lessons, and then translating them into how it would work in our country.
In this moment, what advice do you have for hospitals who are facing immense pressures, and when it comes to both the preparedness but also the leadership?
Priority number one is to support the people at the front line. That's also priority number 2, 3, 4, and 5. Support people at the front line. And that means first, make sure that they get personal protective equipment that they need. Second, make sure that they have a safe place to go. Many people are hoping not to have to return to their home because their kids there, and they don't want to expose their families, yet they want to continue working. Make sure that they get paid. The reports of pay cuts to people at the front line, that's not a fair, that's really, really not a good thing. Let them know that if they do get sick, that they're going to be supported and their family's going to be supported. They're taking a risk and we're behind you. And finally, their experiences are evolving as well. So we've got to be paying attention to their experiences. They're going through a lot of emotional stress that they've never experienced before. So the priority is right now to support the people at the front line. They are truly the heroes in this crisis. And we all, especially hospital administrators and people working in healthcare, have to be behind them.
Last week, when we were speaking with Dr. Michael Minna, we had a conversation about kind of the decentralized way that hospitals are looking for resources right now. And I wonder how you view that in terms of leadership and coordination during a crisis.
So this is a scenario where we don't have enough of, and you can put whatever you want after that phrase. We don't have enough personal protective equipment. And there are extraordinary efforts to find whatever can be found around the world. There's an air bridge that's going on right now with cargo jets that are landing at cities, for example, New York, New Jersey area. They have those needs. So, any and every effort to find what's available is being put into that. The second thing is with ventilators. There is a system that's developing such that leaders will know where those ventilators are needed. And if there's an area that's already past their peak, so for example, Seattle, and they have a supply of ventilators there, that a transport system is being put into place to, as quickly as possible, move those ventilators to the next hot zone. And once that hot zone has begun that's decline, move the ventilators to the next area. So that we're not going to have stores of extra ventilators around the country right now, but in place of that, transportation systems and sharing systems are being put in place to, as best as possible, meet the need as it moves from place to place.
So some of the questions that we've been going back and forth about have been coming up in the Facebook Live questions that have been coming in from viewers and people on social media, but I want to get to some specifics as well. Sure. This one actually is getting really specific. It comes from Lisa, and the question is, what can individuals do to sustain themselves through isolation and quarantining? What kind of planning should we all be doing in case we fall ill or a loved one falls ill?
Oh, that's a really good question. It's a really tough question. First off, just accept that it's hard. We're all going through a really tough time, and you're going to have your strong moments, you're going to have your tough moments. So just accept that. That's number one. Number two, we have in our teachings something called going to the basement. That's that reptilian part of your brain when you feel panicked. And we say that it's important for you to understand that you're in the basement, you're in that panic mode, and then how do you get up into your mid-level brain and get your brain functioning again? And it's important with that to have a to-do list. So talk about your to-do list, that whatever eventuality you come to, if you get sick, what are you going to do? If somebody in your family comes down with the disease. What are you going to do? So that first off, it gives you a sense of confidence that I'm ready for whatever is going to hit us because we've got a really good to-do list. Whenever that event comes up, then the first thing you need to do is, oh, okay, here we are. I'm in the basement. Let's go to the to-do list and let's start enacting the to-do list. And the interesting thing that happens to your brain is once you start taking those steps, it gets you more grounded and it gets you better oriented. And you believe, well, we're going to make it through it because we've got this to-do list. The last thing is after this event, we're all going to look back on it. We're all going to look back on what we did. Some people will do really, really well. Some people are going to have a really tough time. I think every one of us would like to look back on this period and say, we did proud. We did the best we could. It was a real tough time, but we did proud. And so you might want to think every day to do something that you'll be able to look back on and say, I did something that I'm proud of today. It could be calling somebody who's by themselves. It could be reaching out to someone. It could be helping your neighbor. Just after it's all over, what will it take for you to say, I'm proud of what I've done? There were some really low moments, but I did some things I could be proud of. And that, if we're all thinking about that as well, we'll make it through this period. And when it's over, we'll look back and feel we did as best as we could.
So this question comes from Pat. It's in reference actually to what you were talking about at the beginning of our conversation when you talked about some of the similarities of like a hurricane or something and how we respond. But Pat wants to know, how is the emergency response model for a pandemic, or is it different from a natural disaster or terror incident?
Well, all of those are different because it's a different pattern of casualties. If you've got a terrorist event such as what we had in Boston, there are some similarities. I mean, here
Boston
in
Marathon.
Boston, for those, and even Boston Marathon bombings, we actually didn't have a shelter-in-place day when there's a manhunt going on for one of the brothers who escaped into Watertown, and the whole of Boston was closed down. This actually feels, it was this time of year, there's a certain familiarity for us in Boston. So there are some similarities. One of the things, as I said earlier, is this affects everyone, and it affects us very personally. It's our body, it's our health, it's our sense of future, it's the health of people that we care deeply about. So there's something much more personal about this. The other thing is our healthcare system is pretty much geared for what we throw at it on a day-to-day basis. So, illnesses and accidents, and our healthcare system can keep up with that capacity. Our healthcare system is not designed and does not have the wherewithal to meet the demand that it's facing right now. So the system is trying to expand as quickly as possible. We see hospitals being set up in a convention center. So for all those reasons, healthcare is more personal, and it's a greater challenge to our infrastructure and our system.
This is another question, though, when you think about that, how do you get the supply chain moving along to meet those demands in these critical times? Because it seems like we're running out of time.
I mean, there is an enormous effort on the part of the federal government working in close tandem with state and local. The private sector is coming to the table as best as they can. There's some remarkable stories. And finally, there's international efforts to try and move supplies around to areas that are of greatest need. So there are companies that are gearing up their production, and there are tremendous efforts to distribute. I'm going to say that when we look at this in retrospect, everything that we're experiencing in this country was predictable. One of our colleagues at the Harvard Business School, Max Bazerman, wrote a book a number of years ago called Predictable Surprises. And what Max basically says, if you look at a scenario, you can pretty much predict what's going to happen. The moment it happens, it feels like a surprise. But nothing that we're experiencing right now is a complete surprise, because we can see what's going on in other countries. We also knew how many hospital beds we had in this country. We knew how much personal protective equipment we had, pretty much, more or less. And so it's unfortunate that when this was just beginning, that the kind of search and the kind of distribution that we're finding today in the moment of crisis didn't happen a little bit earlier.
There are so many questions. I hope we get to all of them because I'm curious to your answers to all of them. Um, Here's one about messaging and leadership. It's from Shayna. So, what are some effective measures that leaders can use to convey their messages to the public during a crisis? Can you think of an example? And with that, like, how can leaders effectively communicate? What are some of those strategies during a crisis?
So I'm going to go to a different public health crisis. One of our good friends and colleagues, Dr. Rich Besser. Dr. Besser was the acting director of the CDC during H1N1, and he's an extraordinary communicator. He later worked with ABC News as a health editor. Rich is now at the Robert Wood Johnson Foundation. And when H1N1 began, he was called to the White House at a press conference, and the first thing he did is he expressed empathy for people who were watching. He explained what was going on in the midst of this crisis. He said, here's what we know about what's happening, here's what we don't know, and here's what we're doing to, he said, and this is what you can do to protect yourself and to help all of us in the midst of this public health crisis. And he was consistent, and the CDC consistently upgraded and brought up to date their information as they were learning about that pandemic. They were pushing out information as their recommendations changed. They were pushing out that recommendation. For us, that was an example of extraordinary communication in a public health emergency and a good reference point for all of us.
That brings me to a question. I'm assuming this is a different path, but there are inconsistencies right now in messaging and guidelines, whether it's federal, state, local. And sometimes it's contradictory. How do you address that?
That's tough. So as a student of leaders and leadership, we always say in crisis communication, you want to make sure that you're transparent, that you're consistent, that you're empathic, and that you're very responsive to the population. I think one of the problems that we see in this crisis is that the messaging has not been consistent. I think the public is confused. Most recently, there's just a lot of confusion about what to do about masks, whether we should be wearing masks, who's wearing masks. I think the lesson for leaders, and we can always stop in the middle of this and say, okay, what's not been going well? How do we improve it? Is it would be to everybody's advantage, including the credibility of political leaders at the local, state, and federal level. If when messaging goes out to the public about what needs to be done, the more transparent and consistent it is, the better. And if a leader at any level of government or in any company asks people to do something, the leader's got to do it as well. And then role modeling is an important element of crisis communication.
How would you rate that right now? How that's going?
It's all over the board. And, we're seeing some governors that are just doing a remarkable job at demonstrating that empathy. And I think people believe they're doing everything they can to respond to the needs of the public. And I think that's very inspiring. So we're seeing examples of extraordinary leadership, and we're seeing the opposite as well. And once again, we're already asking ourselves questions of, when we look back on this a year from now, what are we going to discover? And so we're still in that process of discovery as we're experiencing this as well.
This is a follow-up from Risa. When you think about this kind of clear transparency and consistency, is there a certain level, or what level of leadership do you think can best provide certain types of information? And how do you see those leaders working together, and what kind of way can they best work together?
Oh, that's a good question. So, everybody is an expert in something. And so some people even expert in their own experience. And, it's really interesting to go back to an earlier question. Everybody's got a story. And, one thing, you have your story, and it's useful to understand other people's stories. So everybody's got a story, and it's important that the people that are giving us the official stories are credible. So the CDC has been a great resource for information on their website. When we're hearing from leaders at a podium, wherever it might be, on medical issues, it should be medical experts. When we're hearing questions about supply chain, we want to be hearing from supply chain experts. And I think it's important for every leader to know, here's my area of expertise. And some people are political leaders, talk about the politics and the reassurance to the public. But it's really important that it's not only that you acknowledge what you know. One of the things, just to go back to what Dr. Besser did in H1N1, also acknowledge what you don't know. And if you're not an expert in a certain area, not to claim expertise.
This is a question from Eric. I often think of like family psychologists as sometimes understanding more keenly kind of broader political dynamics. But Eric wants to know, what about parents who have to suddenly jump into the role of teacher and family crisis leader? I know you mentioned the to-do list, but are there lessons from your leadership studies that could apply to these parental situations?
Yeah. So I'll say as a grandparent, I'm not with my grandchildren, but I do get reports. And this is a difficult adjustment time for kids as well. And it's a really, really tough time for parents. And so I'll give a really pragmatic example. When I spoke to my son yesterday, he has a lot of support in the house, but everybody is thinking that somebody else is taking care of the kids. So what I suggested is put together a plan for the day every day. Here's what we're going to do. Here's the activities we're going to do, and don't wing it. This has been so overwhelming. People say that they've lost track of time. A week ago feels like a year ago. So time management turns out to be an important tool in getting through everything, including our work. But the suggestion was put together a plan every day for the kids, who's going to be with the kids, what the activity is going to be. Let the kids know what the plan is. And then people not only have on time with their kids, they also know when they're going to get their off time with their kids. And that putting that little tool into technique could be really, really important when it comes to the complexities of dealing with children in a scenario we never would have imagined.
This is a very different question, and it comes from Lisa. Homeland Security has a huge amount of vacancies right now, as well as FEMA. So what is your advice on that front during a time when there's desperate needs for crisis leadership at those levels?
They do. And there's no secret that in many positions in the federal government, there are there are vacancies. And there are also people in acting positions who don't have the full authority of being confirmed by the Senate. I'm just going to say that it's a really tough situation for those people. And there are some real heroes there who are stepping up to the plate, who bring an extraordinary trove of activity. And what they're saying is, there might be problems going on. We get it. We're going to commit to do as best as we can under this circumstance. And in some ways, for those people who are in emergency management, people in the military, you take what you got and you do the best you can with it. And I think when this is all over, we're going to find some extraordinary leadership of people who were able to rise to this occasion out of their real, care and concern for this country and the people in this country.
So I want to wrap up just with one more question, just in the last couple minutes we have. Thank you for your time. You wrote a book about crisis management, How to Lead During These Times. And I wonder if you were to update that book based on what you're learning now, how you would update your book and kind of manual for managing during crisis based on what you're learning.
Oh, Lana, that's a good question. We're learning and hearing about leaders who really stepped up to the plate and are accomplishing things that they just could never have imagined they would be doing. I've heard people say, my agency was never designed to do this level of work. My hospital was never designed for this number of patients, for this level of activity. So leaders we're finding are really standing up to the plate. The one thing that really impresses us is that these are times where you might veer from your moral compass. for whatever reason. You might be faced with a really difficult choice. And we find the greatest of these leaders are doing two things. One is they're really aware of what integrity means and how to make the right decision. And the other thing is there's sometimes you're asked to do something that you just don't think is right. And we call that your no line, to say like, yes, this might be what I've been asked to do or what I've been told to do, but no, that's beyond my no line. This is not something I'm going to do. So we're, as a country, and healthcare professionals and emergency managers are having to make some really tough decisions. And just as I said earlier, one day we're going to have to look back at what we're experiencing right now. Will we be proud? And while there are many, many problems and there are many shortcomings in this, in the way our country is dealing with this, there are also many people who can be proud. And I think their story is important, just as the story of how each and every person is living through this. And hopefully we can all look back on what we've done and feel that we did proud.
Well, I think that's a good place to wrap up our conversation. Thank you, Lenny Marcus.
Thank you, Alana.
And thank you to everyone for your questions. This Q&A has been jointly presented by the Forum at the Harvard T.H. Chan School of Public Health and the World with PRX and WGBH. And you can view this full discussion on our Facebook pages, which is at Forum HSPH and at PRI The World. You can also send feedback. And you can learn more about the National Preparedness Leadership Initiative at npli.sph.harvard.edu. And join us again next week, April 16th at noon, when we will talk to Dr. Paul Bittinger about hospital response during the peak of a crisis. So thank you again, and let's keep the conversation going.